Okay. Today we are going to see the implant impressions. Okay. So what is an impression? An impression is a negative replica of the structures of the oral cavity. It helps to record the position of the implants or the abutments and also the adjacent teeth and all the surrounding structures in the mouth. And what are the learning objectives we are going to see today? We are going to understand the purpose of an impression. Okay, to understand the difference in the implant level and abutment level impression. To understand the concept of an implant replica or an analog. To understand the closed tray and open tray impression concept and know the respective coping. Understand pickup impression with impression copings. Okay, what is the purpose of an impression? The purpose of an impression is to share the information that is present on the mouth to the lab with the help of a model. Okay. So what are the requirements of an impression making? You have to know the knowledge of about the oral anatomy and then the basic knowledge of the technique, impression technique that you are going to use. You have to have the knowledge and understanding of the material that you're going to use, and then you have to have the skill. And why accuracy of the implant impression is so critical? Because a precise fit is the utmost importance of an implant process. Failure to record an accurate impression leads to multiple problems such as non-passive fit, incomplete seating, tight contact, improper retention, and unharmonious prosthesis. Okay, so what is the difference between a natural tooth and an implant? So natural tooth is surrounded by periodontal fibers. So whenever there is a pressure applied onto the natural tooth, it is evenly absorbed towards the periodontal ligament. Okay, but whereas in the implant, it is fixed to the bone structure. So there are naturally no fibers attached to the implant. So whatever pressure is applied to the implant, that will directly get transferred onto the bone. There is no shock absorbing system. Okay, so the processes which you are going to give on top of an implant poses a major importance. Understand? So why we should make an implant impression? Because to record the exact position, the depth and angulation of an impression, and then to record the soft tissue contour that is present in the patient. Okay, so there are different classifications such as closed tray, implant level, and direct transfer, and all those. Instead of confusing yourself, you just have to apply what the information and knowledge you know towards the classification. Understand? We are going to focus on the impression after the fixture placement, that is after the implant placement. Okay, at the level of the impression, okay, there are two levels. One is implant level and another one is abutment level. And then based on the coping is the transfer coping, which is open tray and closed tray, the pickup impression, which is also another open tray and closed tray, and then the impression followed by splinting, the situation where your impression needs splinting. Understand? So these are the different components that are used for an impression. Okay, so note this line which is present, which depicts the bone level. Okay, the components which are above the line will be present above the bone level. So the components which is below the line, that blue line, are the components which are going to be buried inside the bone or buried inside the model. Understand? So your implant analog will be down the bone, or which will be inside of the model. Understand? All other components will be above the bone level. So coming on to the implant level impression, which is subdivided into both open and closed tray impression. Okay, what do you mean by implant level impression? the implant level closed ray impression. See, in the first picture, the healing abutment is present. You are going to remove the healing abutment, and then on top of it, you are going to place a transfer copy, a closed ray transfer copy, and then you are going to use a prefabricated or the pre-existing trays, that metal trays you are going to use. You are going to inject the light body material around the transfer coping and then take the impression. Okay. After the impression is taken out, you are going to unscrew the transfer coping. You are going to manually place it on the impression, and then on top of it, the impression analog or the implant analog is placed. Okay. So this is the method of closed ray implant level impression. Okay. This is how the impression will look like. So what are the indications? When there is limited interarch space, you are going to use a closed ray. Whenever the patient is having the tendency to gag, you are going to use a closed ray impression. And then difficult access. What are the advantages? It is easier to take an impression. It is suitable for a short interarch distance. And then you can see and you can fasten the analog. Okay, you can take the transfer coping and then the analog out, and then you can tighten it. What are the disadvantages? Disadvantage always is surrounded by inaccuracies. This type of impression you take for an implant is always inaccurate. So it is not suitable for deeply placed implants, that is subcrystally present implants. Okay. So coming on to open tray implant level impression. Before going on to open tray implant level impression, we are going to do a procedure called splinting. Okay, splinting of a multiple impression. Why do we need to do a splinting? Because literature shows splinting always has the accurate impression or the accurate recording of the angulation of the implants in case of multiple implants. Okay, so splinting before doing a open tray impression technique is always accurate. So these are the different literature that shows the splinting technique generated more accurate master cast than the non-splinted technique. Okay. Now coming on to what are the steps for splinting multiple implants. So you are going to remove the healing abutment and place the transfer coping. Okay. With the help of a floss, you are going to tie the transfer coping, open tray transfer coping, and then with a figure of 8 motion, you are going to attach the floss onto the transfer coping, and then slowly you are going to apply pattern resin on top of the floss and then let it set. And then you are going to inject the impression material surrounding the implant, and then you are going to use a open tray. Okay, the custom tray. You are going to fabricate a custom tray, and then you have to create holes so that the screw vents are visible through the impression tray. Okay, so in the last picture you can see the screw vents are visible, and then after the impression is set, you are going to use the hex drive and then remove the screws, loosen the screws. Once the screws are loosened, you can take the impression out. Understand? So this is also a method of splinting with the help of an open tray impression coping. So after the impression is taken out, this is how the impression will look like. Understand? So you are going to place a implant analog and then over a model. So what are the indications? Indications are multiple implants. In case of multiple implants, you are going to use a open tray implant level impression. Okay, when the implants are very closely located. Okay, what are the advantages? It reduces the effect of the implant angulation, and then it reduces the deformation of the impression material. It is one of the most accurate impression method. Okay, so what are the disadvantages? Some rotational movements of the impression coping can occur. Okay, now coming on to abutment level impression. So what do we do? A direct abutment level impression. you are going to remove the healing abutment, place the abutment. Okay, instead of transfer coping in the implant level impression, you are going to directly place the abutment, and then you are going to inject the material around the abutment and take an impression, and then you are going to place the implant analog. Okay, so the abutment is already placed in the patient. So there will be a transfer jig. Okay, transfer jig, the plastic transfer jig, you are going to place it on top of the implant, which gives a snug fit. Okay, and then the light body material is injected, then the impression is made. While the impression is taken out, the transfer jig, that snappy transfer jig, it will get attached to the impression itself. Okay, it will get attached to the impression. You have to attach the implant analog on top of the transfer jig. And now, what are the comparison between the direct and indirect impression technique? The indirect impression technique requires no tray preparation. Okay, you are going to directly feed the stock tray onto the impression. Okay, and then the direct technique, you have to create windows. Okay, now the type of coping used is round or conical coping is used, but in case of direct technique, a square coping is preferred. Okay, what about the intraoral space? It can be used in patients with limited mouth opening in direct technique, but direct technique, you need lot of space or mouth opening. Okay, and then what about the precision of attachment, precision of the impression? There are chances of distortion in indirect technique, but in direct technique, there is less distortion because you are going to remove the bent hole of the screw and directly take the transfer coping out. You are not going to manually unscrew the transfer coping and then manually place it on the impression. It is already recorded in the impression. Okay, splinting is not possible in indirect technique, and in the direct technique, it is possible. For gaggers, direct technique cannot be used. And then for angulated implants, it is easy to make, and the direct technique is difficult to make. For deeply placed implant, the indirect technique is not indicated. Advantage, indirect method is easy to perform. Okay, whereas the direct method is quite technique sensitive. Okay, what are the difference between the implant and abutment level impression? The coping location. The location of the coping requires subgingival placement of the coping in implant level, whereas in abutment level, you can place the coping supragingivally also. The abutment selection and preparation is done on the model in the laboratory. Okay, implant level impression, you're not going to select the abutment on the patient. Okay, but in the abutment level, you are going to place the abutment on the patient, and then you can trim the abutment also. Abutment modification is not necessary on the patient because you are going to select the abutment on the model in the laboratory only, and then in the abutment level it is needed. Okay, custom abutment, always in implant level you can provide a custom abutment, whereas in abutment level impression you are already selecting the abutment. Okay, so what are the recent advances? Recent advances are the digital impression, implant impression. It requires sensors. Okay, the sensors which is attached onto the transfer coping, and then a digital impression using a scanner is made. See, you can all see the digital 3 implants. The sensors are placed. Okay, the sensors are placed, and then the digital scanning is made. Understand? What are the requirements? You need a digital scanner, and then a software to process, and then a CAM technology, the milling technology to mill the model. Understand? See, this is your digital scanner, and then this is how your digital impression will look like. Okay, so this is how you, with the help of a software, you can do whatever you want. And then what are the advantages for digital impression? Improved patient acceptance. Okay, instead of using all the materials inside the patient's mouth, it is very unmessy. Okay, it is very clean, and then reduced distortion of the impression material, and it is time efficient. Okay. The accuracy of implant. The many factors determine the accuracy of an implant, such as the number of implants, the position of implants, impression material, and the clinical training. Now to conclude, there are different impression techniques and methods, and such as the open tray and closed tray. It depends on the particular clinical scenario. You have to be judgmental enough to select the accurate impression material and impression technique on a particular clinical scenario. Thank you.